Hello, hello. Good afternoon, everybody. My name is Dr. Lian. Nice to see you all. I'm here to talk to you a little bit about the Plab 2 exam and what we can do for you in Plab 2 strategies. Okay. Not too many people know about me, but I'm there in the underground. We have been helping people for quite some time now. A little bit of a history about myself. I did the Plab exam and I passed on my first try. And this was contrary to what I had heard before, that, I needed to do 2 attempts, 3 attempts to get through. The scores are quite challenging to achieve. And, overall, this exam is what? 212 marks? And the doctors do not pass at least 180. So this is one of the things that bothered me coming into this exam. And we are all physicians, so it troubled me quite a bit. And when I did my 2 days at the academy, I really felt like I was not fitting. I didn't have time to practice. I didn't have enough money to stay in the UK to pay for a hotel and, to pay for practice sessions. So I just decided to go ahead and use what I had, and I passed with a 159. Okay, so I decided to stay on and help my couple of friends. This was never an intention to teach the Plab. But staying on and assisting doctors achieve a high score in the Plab is what we are about in Plab strategy. So anyways, let me just get started. I know this session is being recorded. I will have it uploaded on YouTube in a couple of minutes when we are done. So what's the key to this thing? How do you pass the Plab 2? Okay, you have to be absolutely different from everybody else. Okay, and it's not that every station matters, and this is the big concept that I see with people that I teach and those that I do mocks with. It's about the patient. If you focus on the patient and listen to what they are telling you, responding effectively, you will honestly do well in this exam. Okay, so this is a brief introduction. I want to introduce my team. We have Dr. Chinedu, Dr. Dami, Dr. Babafemi, Dr. Meza, Dr. Thet, and Dr. Adam. I try and keep it really small because I want the quality of what we are teaching to continue. We do not use scripts. And for those of you who cannot afford an academy, £600, a week in a hostel, I usually tell people, if you can get this book, and even now that we have time to study for the Plab, if you can get yourself one of a structured book that teaches you how to practice as an FY2 in this country, you are better off practicing with a couple of doctors, doing a couple of mocks, and coming in and doing the exam. It is a no-brainer, honestly. I don't know why there's too much stress about this exam. So kindly, as I go ahead, I'll just have you mute your mic, so I'll just mute them for you so that we can just move on. Okay, so who are we? We are doctors helping doctors. Okay, we have made an online platform. That way, in the comfort of your living room, in the comfort of your cell phones or in your cars, you can listen to lectures. You can practice with dedicated people. I have 3 WhatsApp groups that are running at, goodness, I think at capacity now. Serious people who just want to conquer this exam, We also have group mocks for those of you who want to practice in a group setting. Okay, I hold 3-day courses, 10-day courses, scorecard reviews, because I tell people, honestly, if you have attempted this exam once, you owe it to yourself to sit with someone, not even our team, get a friend, sit down with them, talk to them about what you may have done wrong. Look at the mistakes that you have made. Think of, why did they deduct points for me for management? Why did I get a 0 in a whole station that you were there slaving for a good 8 minutes? What could you have done wrong? And then, after you've focused on your mistakes, you train. This exam, you have to train for it. And you train, above what is needed. When I'm teaching my doctors, and I call them my doctors, I always say, plan for a marathon, and then it'll be easy for you to run a 5-kilometer race. My background is from Kenya, so we, most of our our synonyms or our morals of stories are around running. So that's what I usually tell them. When I was practicing for this exam, I honestly could do 18 to 36 stations a day. Me and my roommate, we could not go into the academy. And I think somebody's microphone is on. Let me just help you and mute it nicely, okay? Yeah, that way, when you're in an 18 station exam that is 3.5 hours, you don't want to be losing stamina at station number 10. And that's what people fail to understand. The first time they see 18 stations is when they're in the exam. That's a big injustice to yourself. You should already be practicing with 18 stations, maybe a one-to-one basis. Okay, somebody's microphone again. You owe me coffee. If you unmute your mics, the mics should be off when you sign on, yeah? So for those of you who are just, finishing Plab 1 and you're coming into Plab 2, it's 18 stations. There are actually in total 20 stations. Then there are 2 rest stations in between somewhere. You should prepare for, problems in your exam. You could start with a rest station. Everybody else has gone in and you're there waiting for it, 8 minutes, okay? You could start with an examination. You can start with a station that's an emergency. You have to get yourself into such a mode where you can adapt, okay? And the problem that I have most of the time is people are coming to me after going to an academy for 6 months and they've crammed the scripts, and then they go into a case where, for example, the patient is obese and they want surgery, and they say, okay, we'll offer you surgery. They don't bother to ask differentials, just because a patient is coming into the hospital and saying, doctor, I've been adding a little bit of weight, can you offer me surgery? You can't just offer surgery without checking for polycystic ovarian syndrome. You want to check, where is this weight distributed? Do you have weight increased neck size? Is it around the waist area? Is the weight mostly in your legs? We have to check, cardiac. You also want to check hyperthyroidism. Depression is so big in this country. So just because a patient is coming in and saying, I want surgery because I'm obese, the script will tell you, offer the surgery. But when I teach my doctors, I say, before you offer surgery, you have to do the basics of medicine. And that's what we do in our course. We take you back to the fundamentals of medicine. You use the knowledge that you already have from your background in medicine. You apply understanding and application to whoever is before you, In my exam, I was told by my academy, never offer antibiotics to someone who is coming with a sore throat. And I said, you can't tell me what to do and what not to do. Okay, doctor, I am going to just mute you there. You can't tell somebody, don't do this, don't offer an x-ray, don't offer antibiotics, say this is a case for day surgery, do the MMSE here. How can somebody tell you what to do with a patient they have not met? I know people are trying to assist each other in this exam, but that's what's clouding judgment. After being told don't offer antibiotics, I said, it depends on what I see. So people are going into the exam, a woman is saying that I'm having a sore throat, and they're saying it's viral. How do you know it's viral? You've not checked for lymphadenopathy. You've not even checked their throat. You haven't checked their vital signs. The case could have twisted for you. Okay, so this is the type of thinking we try and ingrain in our doctors, and our mocks are hard. I do train with my team just to make sure that the quality is standard throughout the board, and they have passed the Plab 2 exam. So I make sure that at least the ones who are training you are not people who are waiting for the results to come out as they, as they train the doctor. It's not right, So some of the shortcuts that I see around really, really trouble me, and that's why I teach this, because many of my friends have failed this exam. They've paid so much money into it, and yet they are being misguided. Okay, so I'd rather stay back and do a little bit more in helping the doctors, and then continue on with my career. So here we are. What is this exam about? You have to know gracing us with their voice. The thing is here, what's this exam? I've told you it's 18 stations or 20 stations in total with 2 rest stations. Eat the cookies, drink the water that they're providing. You need the glucose, okay? I cleared those cookies and I drank the water that they had for me, and I was able to continue with a good level of energy for the rest of the cases. They are assessing you on 3 aspects, and there are 4 points maximum: data gathering, management, and interpersonal skills. You can't just overload somebody with interpersonal skills at the beginning of the station. It looks awkward. Oh, hello, Samantha Jones. Welcome to the clinic. It's so nice to see you here. None of my patients ever come back for their results. I'm so glad you do. That's fake IPS. How do you use your interpersonal skills? You spread it out through the whole case. You approach them with a smile. If they have made a mistake, you don't first bombard them with their problems. The social aspect. You know, on my day of my exam, it had snowed. So every single person, I was talking about the weather. You know, how did you manage to get in? It snowed in Manchester today. Please be careful when you're leaving, you know, it's wet outside. They haven't poured enough salt. Everybody, in every single one of my stations, family history is not just asking, do you have any family problems in your family, any chronic problems? No. What type of a doctor asks such a rigid question? When you're doing family history, start with first, who do you live with? Did they come with you for this visit? Okay. How is the situation at home? Are you able to make ends meet? Is anybody else in your family suffering with headaches, with high blood pressure? Okay. How are they doing? Okay. People tell you, oh, my grandmother has hypertension, and then you leave that in the air. You'll miss points for your interpersonal skills. Okay. So these are the little differences that I do when I teach the course. And it really goes a long way changing the atmosphere. If your patient is anxious, you cannot be anxious. If they're crying, even though you're very emotional, you can't cry. I've done mocks with people and they start crying when we're in a case, and I say, I know you're compassionate, but you can't start crying when a patient is crying. When a patient is very angry, you can't talk over them. You can't say things like, I understand. I can see what you're going through. Don't worry. There are some words doctors should never use. And honestly, coming into this country, I didn't know that medicine can be practiced in such a way. It is effective the way they do it in this country, because it's not 100% medicine. There's a balance. There's the social aspect. There's the medical aspect. Sometimes you're a big brother. Sometimes you're a big sister. You know, for example, a minor is coming into the hospital to see you for the first time. 14-year-old who is looking for what's some of the interesting things we see in the hospital. They are coming in for emergency oral contraception. The first question you should ask a minor is, Samantha, how old are you, 14? You came by yourself? You know, usually if you're under the age of 18, this consultation should have a guardian present. It shows you understand the age factor. You can't just be talking to a minor without first introducing this. It's Monday morning. Are you supposed to be in school? No, doctor, I had unprotected sex yesterday and I want emergency contraception. Please, can you help me? Okay, when it comes to sexual health, Samantha, then you can talk to the doctor without a guardian being present. Okay, and that's the essence of this exam. You have to adapt station by station by station. And the specific scoring, if you look at scorecards, and we do scorecard reviews, I find very many people having problems with consultation. They have the knowledge, but they do not know how to arrange it in a station. People are running out of time. If your station has an examination in it, that is something you must do. I tell my doctors they have to use the 3-2-3 method. So 3 minutes for data gathering, 2 minutes for examinations. all examination stations, you should max it out in 2 minutes. I'm so surprised when I see people doing an abdominal exam for 3 minutes. I'm like, what are you doing? Chop, chop. You don't have time, because after you finish your exam, you have to manage the patient appropriately and have a plan afterwards, so that you're not the boss of the whole situation. You're teaching them, you're doing the exam, the patient is not talking, you're not finding out their concerns. This is how people lose points. They don't lose points because of lack of medical knowledge, it's application. Okay, other things. So we have consultation, time management, examination, diagnosis, listening. We do this in our team meetings, where when we are doing our mocks, we'll say something like, doctor, I've been taking ibuprofen 600 milligrams every hour, and the candidate doesn't hear that. So where is your mind in the station? You should tell the patient, ibuprofen 600 every hour, that's too much. And even at this point, I may need to even check your stools for occult blood. Are you having any stomach pain? I may need to do an examination. Okay. Now, you all know about the new updates. All exams have been cancelled, and the new batch is starting July 1st, 2020. So I have a class that's a class on Friday starting April 10th, and a class on Saturday starting April 11th. And every single week, I am going to be working with doctors for 3 hours, so that you can be in Plab mode. You don't want to wait for the end of June and say, okay, I'm going to join a course and I'm going to just cram. No, these are skills you need to build over time. Okay, so you're welcome to join us. How do I conduct my courses? Online. Okay, I have morning classes and evening classes most of the time. All right, I teach my templates, so it's not a selfish, it's not a selfish course. I give my doctors everything. My lectures are on YouTube, so some people may not have a chance to join me in class, so I put some of my lectures on YouTube. And I've had doctors who told me, Leanne, I couldn't join your course, but I just listened to your courses on YouTube over and over and over again. I came into the country and I passed, and I say, good, God bless you, go on your way. Okay, this is how I start my courses. When I start, I say, make this your last Plab 2 class. I never want to see my students again. So if they're having troubles, my cell phone number is available. My team doctors are available. If you're having a hard time, if you're questioning some medical practice, we always refer people back to the books. Okay, this is one of the really good books that I like, the Foundation Program. If you're coming in this capacity, honestly, get this book. And there are some PDF copies online, of course, yeah. And out of good graces, just send the authors a few pennies, so that we are not just stealing information from them. I always recommend just sending some money to them. Okay, we go through what the Plab is about. I always have this template of past, present, and future. What happened to the past, in the past of this patient's life? Why do they have the disease? How are they doing now? And the future, okay? What will we give them in terms of information, so that they're not frequent flyers? You never want your doctor to keep coming back with the same disease. What is going on? Okay, so for example, this case where you're teaching a student how to do a speculum exam, it's important to tell the student that before you do a speculum exam, of course, you're going to go through the protocol of, this is the procedure, the proper exposure, the chaperone, you're going to get a consent, clean your hands, look for the hand sanitizer in the room, it is there. Okay, clean your hands, gather your equipment, tell the student to be organized. With every teaching case, you have to ask the student a maximum of 3 questions. They are not there for an exam, so you can't keep bombarding them with questions. And in the end, what is the purpose of teaching a student? Not for them just to get knowledge, but, not for them just to get knowledge, but to know what to do with this knowledge. So for example, the speculum exam, tell the student, every time a speculum exam is done, you have to tell the patient, she may notice slight bleeding when she goes home. This is normal. Why? If you don't tell this to the patient, they will come back to you 15 minutes later, say, doctor, I think I have a problem, I'm bleeding. Okay? When you're teaching a student to do a knee exam, you have to tell the student about the RICE, the RICE. So we've done this whole examination. In the end, the patient may be told to rest the limb, to elevate, to put some ice and some compression on it. Okay? I go through different documentations that FY2 is supposed to know how to fill in your CPR forms, incident forms. You know, all we do is tell patients, I'm going to write an incident report, I'm going to write an incident report. What if you get a station about writing an incident report? You should be able to do it. How to fill in a death certificate, okay? So that's why I say, practice above the expected level and you will not be afraid of passing. Honestly, in my exam, after my exam, my dad asked me, did you pass? I said, honestly, before God, if they do not pass me this exam, then I do not know whether my fit is in the UK. I did everything that was necessary for me to do for each patient. Even when I was tired and I was fatigued, I was giving my smiles, I was handshaking. Of course, now you're not going to be handshaking because of this COVID nonsense, yeah? But I made sure that each and every single patient received the proper care, okay? And so now, what do we do in our online classes? Depending on which one you join, the 3-day, the 3-hour, the 10-day, and now this extended course starting April all the way to July, okay? I try and go down each and every system. Most of all, focusing on the ethical breaking bad news, counseling scenarios, because you need to keep these in your mind. And another big myth is that there are counseling stations. Every single station in the exam is counseling. The last 2 minutes, when the bell goes, you know, the 6 minutes are gone and you only have 2 minutes left, the last 2 minutes should be for you to counsel the patient on their disease, talk a little bit about management and a plan for the future. You cannot be gathering data in the last 2 minutes. You're wasting time, okay? How to approach challenging patients, angry patients, distraught, anxious, emergency cases, okay? For example, if you have to break bad news to a patient who has HIV, you don't want to take a whole 6 minutes gathering data because you have to break the news and give management. You can't leave yourself just 2 minutes for that. HIV management is so broad. You have to talk to them about antiretrovirals in a way that they can understand. James, we are going to give you medications to lower the level of the virus, give you a chance for your immunity to boost up. We have to check your viral load. Okay, that's the first point of management. Second one, I would like you from today to start having safe sexual interactions with condoms, diaphragms, and cups. We will send you to the GUM clinic. They will manage your care. They even have HIV counselors there because this is a challenging disease. Unfortunately, medicine has not come up with a cure for it. But with proper management, compliance with your medications, you know, coming back for your visits, you can manage this disease appropriately, you know. And last but not least, we have to let your partners know, okay? So even with HIV, how you prepare your information, let me just help you with that, okay? How you prepare your information is so important. In the mocks, people, when it's time for management, they start management, partner notification. You're going to fight with that patient through your 2 minutes, you won't finish. So it's not only just saying partner notification, is when do you say partner notification? At the end, make sure you first talk about the meds, HIV counseling, the safe sex, the GUM clinic, and then you hit them with the partner notification. So you see, this exam is not just about medical knowledge. It's about understanding and application. And that's where most doctors have a hard time, okay? For example, let me just go through this case real quick before I can talk to you in the chat room. Easy case. A student is coming in late. They come in late all the time. I don't know what's wrong with them. In my country, we were never late, okay? Always on time. A student comes in late to the surgical ward. You're the FY2. Talk to them. So you go to the student. Hello, my name is Dr. X. What's your name? My name is Samantha. All right. So Samantha, how are you doing? You never start a station by bombarding somebody with their mistake. So sure first. You know, what year of medical school are you in? My first year. Okay, are you enjoying the unit? It's surgery. What are some of the interesting cases you've seen? Any challenges at all? You know, is there something in specific you want to see in surgery? Doctor, I want to see cabbage. Okay, well, we'll see what we can do, and I can organize with the cardiothoracic team for you. When you have some downtime, you can always go and see a cardiac surgery. Now you tell me, at this point, you are already at an IPS of 4 without even trying, as opposed to going in like every other robotic doctor. Hello, what's your name? Samantha, thank you for coming in. Do you have any idea why I have called you for this meeting? Who has an idea? This exam is really not hard. It's junior level basics. They have tested your knowledge in Plab 1. They just want to see, are you compatible with the system? Okay, it's always good to have a pleasant doctor. All right, so with a student, a little bit of pleasantries in the beginning, but no, don't smother them with honey in their dripping IPS. Oh, you're the best student. Simple, dignified rapport. 2 sentences, done. Then now you can ask them a very logical question. Did you come for orientation when we started with the students in the first day of surgery? Yes. What times did they tell you to come in? Well, they told me to come at 7 a.m. and to leave at 5. So what times have you been coming in, Samantha? That's how you trap them. Because she's been coming late, she'll tell you I've been coming in at 10 a.m. All right, is there a reason why? Have you not been feeling well? Is everything okay? Who do you live with at home? Do you live far away? Okay, tell me, because you want an open-ended, you want communication, okay? You say something like, in 24 hours, how do you spend your time? Why? You want to give them a chance to talk. So it's not just close-ended questions. Do you live far? How far do you live? What time do you get here? What do you do? We don't do that. If you take my course, I usually tell them, please, don't go and start asking close-ended questions in the exam. It doesn't offer any service to the patient. So let Samantha, the student, tell you what she spends with her time. Then you have a picture of what is going on, and you become her time management class. What is the point of her talking to you and then you send her to a time management class? Oh, I want you to go and see the time management specialist. I want you to go and see the educational supervisor. No, you become her time manager. You give her a plan. You tell her, let me get a pen and paper. You look for it, grab a piece of paper and say, let's structure your time. Sleep early, wake up early, study. Which challenges have you been having? Anatomy? I can refer you to one of our doctors here. They are good in anatomy. Okay, and honestly, if you come in early, then you may be able to catch that cardiothoracic case that you want. Which cardiothoracic starts at 10 a.m.? You have to be here early. Okay. Another thing I always tell my doctors is to bring it back to the patient. You never say things like, this is going to ruin your evaluation at the end, or the doctors are going to see you in bad light, or you're going to ruin your reputation. All that is rubbish. Bring it back to the patient. And I say things like this to the late student. You know, were you here in the morning for report? No. So you do not know who is NPO on the floor. You do not know who has developed a DVT or a PE. You do not know whose surgery has been moved up because of complications. Yet you have been seeing patients. You are working blindly, Samantha. It is not safe for any member of the staff to work blindly. If you have not been here for morning report, then you do not know what is happening on the unit. If a patient is NPO, they may ask you for water. Maybe they don't know what NPO is. and innocently you give them water and put them at risk for aspiration while they're going for surgery. This example now sticks in the mind of the medical student, and then they realize, okay, I won't be late again. So this is how I teach my stations. I give and I tell my doctors, write your notes, please. And I'm so happy because now out of my classes since like December now, almost 12 people are teaching the course. And it's something I advocate. You cannot be selfish with knowledge. I tell them, learn this information to a place where you can be able to teach it. Because there are so many people who need help, especially now. Okay, so I'm hoping one of you will be a Plab teacher in the future. Okay, and if you want to know how to start, I'll show you. Okay, other things like ductal carcinoma in situ. In my exam, I never asked permission to look at the note. It's my office. You're the doctor. I was saying, okay, let me see if I have a pen and a paper here. Okay, can I draw for you what is actually happening? This is what we saw in when we did the testing. You had a fine needle aspiration and cytology. We have noticed that you have ductal carcinoma in situ, which if this is the duct of the breast, the cancerous cells are localized inside the ducts. You have to pace yourself when you're breaking bad news. I tell people to count up to 4 seconds because sometimes you don't know how to pace. You tell them you have cancer, then you wait. Count 4 seconds, then move on slowly, asking them, is it okay for me to proceed? I'm very sorry. Every person you break bad news to, you have to ask them in the end, what are your plans for the rest of the day? I want you to be around people who will support you. Take the day off from work, Samantha. Go home and rest. Talk about it with your family members. If you need support, we are here for you. Okay, and I'm kind of rushing because I want to really see your questions, and I think I saw somebody's hand that was raised, so I'll answer the questions in the end. What else do we do with me and my small powerhouse team? We offer mock exams. Okay, so they're usually on Skype. We try and bombard you with stations, 5 stations in 1 hour, back to back to back to back. Extreme stress, because in stress we'll be able to see your weaknesses. Okay, then afterwards we go into a detailed feedback. I always tell the doctors who are doing the mock, write down the mistakes of the person who is taking the mock so that in the end you can tell them, this was your mistake, this was your mistake, this is where you rectified, you wasted time, and I even put timestamps. You broke the news at 6 minutes and 54 seconds. Okay, and moving on, what is the plan that they need? Okay, we keep records of people's mocks because we don't repeat questions unless you're having a challenge in a certain station and we're like, okay, this one needs to go back and review hernias, so let them give it to them after a couple of sessions. Okay, the other stations like group mocks. In the NHS, you'll have to talk in front of doctors, and I always encourage people, join a group mock. You know, you're in front, of course it's a platform like Zoom or Skype. Okay, and I'm the actor and you're the doctor, and I give you a stressful situation and you have to answer the questions, and the rest of the observers are also giving you feedback. It's really good to build up that morale. And this is another thing I tell people, because one of my best students, honestly, he was so frustrated with relocating to this country, trying to make it in the Plab, had failed twice. He started working as a pizza guy in Domino's until somebody referred him to me. You know, we had to erase all the bad practices. Hasn't been practicing for almost 10 years. He succeeded with a 169. It is possible, whether you've been in clinical medicine, whether you've been at home taking care of family, it's fine. You can come back to this exam and really succeed. Give yourself a chance. Okay. How do we examine you when we need you to do an examination station in a mock? So what we usually do, it's a step-by-step approach. So how I usually do it, if I want a doctor to tell me how to do their respiratory exam, we'll talk about it. I'll tell them, let me time you. Tell me what you're going to do in a respiratory exam. What are you going to do in a knee exam? What are you going to do in a speculum exam? Okay. We are now working on a virtual platform and on-site preparation. So at least now those who have worked with us will be able to have a place to come in and practice on mannequins. So this is in development, okay? So all this hold up with the virus, the coronavirus is actually working well for us because now we have time to set up. That way, when our doctors come in, they can practice and move on, okay? All our bookings are online, as I had mentioned before. We have multiple networking. There are now three groups, and honestly, the 100% strict. None of this business of coming in and posting your business or talking about rubbish. No, 100% Plab material. If you're there to find a partner, you find a partner and you exit. Come back, get another partner to practice with, exit. Okay. I talked about our group sessions, our group mocks. I also have this thing of accountability, which we use the platform called SurveyMonkey. We want to see whether we are making any effect in this Plab world. You know, because if we are not, it's best for us to leave. We want to see how many of our doctors have attended the courses and are passing. You know, the previous group are the ones who actually advised us, can you change the timings? Are you able to do this? Can you change it in this other way so that for the next class, it's much better, okay? So here are a couple of our things. This is our Facebook page. This is me over here in the corner. I went to school in a nice little island called Grenada. So if if you're looking for people to go to medical school, send them there. In fact, most of my teachers were Nigerian, which is really excellent people, okay? How do people know about us? Mostly it's word of mouth, honestly. And I think this is the best thing because there's no need to advertise. A good thing advertises itself. My doctors come back, they've passed their exams. I'm really so humbled. Even some of them get higher scores than me. Fantastic. If you want to read our reviews, they're online. We have them on our plabstrategies.com. All our sessions are there. Every now and then I do a free Zoom session. Like I did one on Monday. It's on our YouTube page. I was just talking about different settings. The study materials, I provide PDF notes, foundation year PDF notes. It's not a script. Please, please, please. We're not here to discuss scripts. The scripts are becoming obsolete. Okay, I always advocate for this handbook, the Oxford book, this one here. Of course, they don't even know me. They're not giving me any shares, yeah. But I always send my doctors back to the CKS guidelines and NICE. I send them back to the NHS website, okay. And this is the thing, because we've seen doctors who come into this country, they practice, they pass the Plab, they go in and make fatal errors in the NHS. In the NHS hospitals, excuse me. And now that's the thing. It's not a very forgiving system. That's why if you are in the business of medicine, you always have to be an advocate of studying. You have to study, guys. One of the sad reports that I got the other day is a FY2 who is told by the consultant, go and give a certain medication to a patient. The patient ended up having end-stage renal failure and they're bleeding through their Foley catheter. And in their panel of review, the doctor was asked, why did you give this medicine? And they said, the consultant told me to give it. The consultant was told, you ordered the med. The consultant said, well, I expect my team to always review the information I give them. I always expect them to go and check through the books. So now it's not the problem of the consultant, but the problem of the FY2 doctor. Poor fellow, left out to dry. Why? Because they just get information and go and do it. And I said, I wish you checked with your registrar. I wish you checked with a fellow SHO before you went and gave these meds. Now look, you've gone through the whole Plab process, you've relocated your whole family to this country, and now because you're so used to being spoon-fed, you see, the outcome. And that's the thing. I want to break this thing of people wanting to be spoon-fed for medicine. You're too powerful for this. You're too powerful to just grab a script and say, Dr. S course is telling me I have to say my patient has Stock Adams. Dr. Y is telling me not to give antibiotics. How can you practice like that with all that power? You're a puppet. Okay, so that's why I tell my doctors they have to read, honestly. And even in my classes, when we start, I don't allow any newcomers because I always like to lay a good foundation. I have a humble little website, a little page or whatever, link. I'm not too good with these terminologies for computers. Here is a YouTube link. Okay, there are a couple of videos. This is the video I was telling you about, the role of the junior doctor. I think, yeah, 2 hours. This one here, the NHS common diseases, differential diagnosis. You do not want to be thinking of differentials in the exam. They should be on your fingertips. So I teach different ways of mastering differentials. For example, and I think somebody's microphone is, okay. Let me just reduce that one a little bit. Here, where are we? Sorry, let me just go back here. Sorry. Yeah, differentials. Literally, you should be on your fingertips. A patient is coming in and they have back pain. You can't be start thinking, what will cause back pain? What will cause back pain? I hide my differentials in the question. Let me help you again. Somebody's microphone is unfortunately. Dr. J, you owe me coffee. Please don't unmute your mics, yeah? Yeah, so differentials. Patient comes in with back pain. What do I want you to think immediately? Back pain, P-A-I-N. Number 1, prolapse disc. P for prolapse disc. A for triple A. So every single patient with back pain needs an abdominal examination for you to see the pulsating mass. I for itis, inflammation, okay? It could be spondylitis. It could be Pott's disease, okay? And then N, neoplasms, kidney stones. Asking them, is the pain moving from the back all the way to the midsection and the groin, okay? And then neoplasm with your cancers, and then S for stones. So this is how I teach my doctors the differentials. Good video, go ahead and watch it and make your own notes from it, all right? For those who are aspiring surgery, we have a good wing with MRCS strategies there. Fantastic group of surgeons who are also teaching, and I'm also a surgeon. In fact, my past history was working on a surgical ship, of course, for free, on the outskirts of the African continent. But anyway, yeah. So we're also practicing with doctors when it comes to surgery, because again, it's a different strategy. Okay. Any questions, please, by all means, just email us on that email also. Here is my favorite part about all this, okay? It's the feedback, honestly. I am extremely, extremely humbled. I never thought it would get to this point, you know, helping one person literally and them taking my information and spreading it to the world. And that's how they made these WhatsApp groups and invited me, told me to keep teaching them. Our prices are fair. I think our 10-day course is £110. No, it'll never get to 600. Are you kidding me? That's too much. 600 for a week course? Forget about it. And that's why I want us to break the system. So if you learn this material well enough, you can go and teach it. Okay, I have my people passing with 158. This is a case I will never forget again. And she passed her Plab 1, and I think 2017, failed the exam 3 times and passed the last time. My gosh, she made me weep. Yeah, and I celebrated with her. Anybody who sends me their scores or tells me they've passed, I celebrate with them in whatever capacity. So I say we are happy, we are humbled, and we feel appreciated. At least we are doing something good, okay? And may we continue to grow in this wisdom and strength to teach the right thing to others so that they can also help others. So dare to be different. Can a doctor please get a 200 in this exam? What's going on? We're supposed to be some of the smartest people in the world, yeah? Here are my last few groups. This doctor got a 170, and he told me he had to leave one for the examiner. Passed 17 stations. Fantastic. I've had a 177, I've had 165s, honestly. And some of these people, honestly, it's not that they are bad doctors, it's the organization of information. Like I said, you're coming in with knowledge, keep it. Keep your good knowledge, organize it better. Many of you may not even need to take my course. Go watch the YouTube videos. Do mocks with your friends, okay? Don't spend too many months for this exam. Give yourself time, but when you focus in, when you zoom in and say you want to study for the Plab, study for the Plab. It is possible. I'm still waiting for a doctor to get 180. So what's the future of all these things? We're going to continue with our online classes. We are still setting up for like an established place for study, okay? And maybe even being able to reach out to people who are not able to come to this country in a different way. So all this is in the works, but in the meantime, we'll still continue with these online classes, yeah? And I always like to end with a word of encouragement, because if your spirit is up for this exam, it'll show. I don't want you going in too beat, too tired, too fatigued. It'll show, okay? I want you to keep your motivation high. Always believe, and this is one of my favorite sayings, and I always share it in my class. Sometimes when you're in a dark place and you think you've been buried, actually, you may have been planted. So give yourself time to grow. You need good water. You need good teachers. You need good people around you. Even for when I was doing my exam, I had to stop going to some of these academies because they would totally kill my spirit. Some of them even told me, you'll never pass. What are you talking about? You're saying things that are not in the script. And I said, I don't have time to change my way of practice. This is who I am. And I don't want you to change who you are. You can always, always improve, okay? So thank you so much for giving me your attention. Let me see if you have some specific questions in the chat room, okay? I am going to stop share here. And